Hello, Namaskar. I am Dr. Murali Manohar. Welcome to my lecture, Ayurveda Samhitha. In this program, we will be learning and knowing about an important topic and some powerful ancient Indian Ayurvedic secrets. These can change and improve your entire life.
Thinning hair. Causes and Ayurvedic solutions. 1. Hair is tied to self-image. Long, short, bouncy, sleek. For most women, hair is far more than a bundle of fiber. It's an expression of style and personality. If an occasional bad hair day can make a woman feel bad, hair loss can be a distressing sight to face every morning in the mirror. Hair loss is called interruptum in Ayurveda. This module focuses on Ayurvedic treatment for hair loss. But before that, let us know some important facts and figures. Two. Hair loss common in women too. The idea that thinning hair is a guy problem is simply wrong. 40% of people who experience temporary or long-term hair loss are women. Some have hair that is thinning all over, while others see the center part gradually widen. Still others develop distinct baldness at the crown of the head. Unlike men, women rarely develop a receding front hairline. 3. How hair grows. The average scalp has 100,000 hairs. Each follicle produces a single hair that grows at a rate of half an inch per month. After growing for 2 to 6 years, hair rests a while before falling out. It's soon replaced with a new hair, and the cycle begins again. At any given time, 85% of hair is growing, and the remainder is resting. 4. How much hair loss is normal? Because resting hairs regularly fall out, most people shed about 50 to 100 strands every day. You'll typically find a few in your hairbrush or on your clothes. Abnormal hair loss can happen in several ways. You may notice dramatic clumps falling out when you shampoo or style, or your hair may thin slowly over time. If you're concerned about changes in your hair, take the Ayurvedic treatment. 5. Finding the roots of hair loss. Hair loss in women can be triggered by about 30 different medical conditions, as well as several lifestyle factors. Sometimes no specific cause can be found. As a starting point, testing for thyroid problems and hormone imbalances is recommended. In many cases, hair will grow back once the cause is addressed. 6. Measuring women's hair loss. The Savin scale is a common measure that ranges from normal hair density to a bald crown, very rare. It's helpful in documenting female pattern baldness. which affects women. Genetics and aging play a role in androgenic alopecia. Along with the hormonal changes of menopause, hair may become thin all over, with the greatest loss along the center of the scalp. A receding hairline is very rare in women. 7. Thyroid problems. The thyroid is a butterfly-shaped gland at the front of the neck. It produces hormones that regulate many processes throughout the body. If the gland makes too much or too little thyroid hormone, the hair growth cycle may falter. But hair loss is rarely the only sign of a thyroid problem. Other symptoms include weight gain or loss, sensitivity to cold or heat, and changes in heart rate. 8. PCOS. Women with polycystic ovary syndrome, PCOS, have a chronic hormonal imbalance. The body makes higher levels of androgens than expected. This often causes extra hair to sprout on the face and body, while hair on the scalp grows thinner. PCOS can also lead to ovulation problems, acne, and weight gain, but sometimes thinning hair is the only obvious sign. 9. Alopecia areata. Alopecia areata causes hair to fall out in startling patches. The culprit is the body's own immune system, which mistakenly attacks healthy hair follicles. In most cases, the damage is not permanent. The missing patches usually grow back in 6 months to a year. In rare cases, people may lose all of the hair on their scalp and body. 10. Ringworm. When ringworm affects the scalp, the fungus triggers a distinct pattern of hair loss: itchy, round bald patches. Bald areas can appear scaly and red. Ringworm of the scalp is treated with Ayurvedic medicines like Mahamarichiani. The fungus is easily spread by direct contact, so family members should be checked for symptoms too. 11. Childbirth. Some women may notice their hair seems fuller during pregnancy. That's thanks to high levels of hormones that keep resting hairs from falling out as they normally would. But it doesn't last forever. After childbirth, when hormone levels return to normal, those strands fall out quickly. This can mean a surprising amount of hair loss at one time. It may take up to 2 years for hair to return to normal. 12. The pill. A little-known side effect of birth control pills is the potential for hair loss. The hormones that suppress ovulation can cause hair to thin in some women, particularly those with a family history of hair loss. Sometimes hair loss begins when you stop taking the pill. Other drugs linked to hair loss include blood thinners and medicines that treat high blood pressure, heart disease, arthritis, and depression. 13. Crash diets. You may lose more than weight with a crash diet. People may notice hair loss 3 to 6 months after losing more than 6 kilograms, but hair should regrow on its own with a healthy diet. Be prepared to shed some locks if your diet is very low in protein or too high in vitamin A. 14. Tight hairstyles. It's no myth, wearing cornrows or tight ponytails can irritate the scalp and cause hair to fall out. The same is true of using tight rollers. Let your hair down, and it should grow back normally. Be aware that long-term use of these styles can cause scarring of the scalp and permanent hair loss. 15. Cancer treatment. Hair loss is an infamous side effect of 2 cancer treatments, chemo and radiation therapy. In their quest to kill cancer cells, both treatments can harm hair follicles, triggering dramatic hair loss. But the damage is almost always short-lived. Once the therapy is finished, hair usually grows back. Ayurvedic supporting therapies can minimize the side effects of chemotherapy. 16. Extreme stress. Extreme physical or emotional stress can cause a sudden shedding of 1/2 to 3/4 of the hair on your head. Examples include serious illness or major surgery, trauma involving blood loss, severe emotional trauma. The shedding may last 6 to 8 months. 17. Ayurvedic home treatments. Collect the soft and green leaves of beetroot and boil a few in water. When the leaves become tender and soft, take them out of the water. Now grind the leaves fully to a homogeneous pulp. If water is needed, only that water should be used in which the leaves had been boiled. Repeat the procedure in a similar way, but this time replacing the beetroot leaves with henna. Now grind both the leaves together. Apply this paste over the head liberally. Allow it to dry and then wash it with lukewarm water in which a few drops of lime juice have been added. Repeat the process for 1 full month. It is expected that within this period hair will again start to sprout on the bald area. After doing this treatment for 1 full month, repeat it after every week. It is a very good remedy and many bald people have now lush growth of hair. But, as told earlier, it could be useful only when the thinning has not been due to the hereditary factor. Rub on the scalp 1 teaspoon oil in which raw mangoes have been preserved for over 1 year. Repeat this treatment frequently. Grind 1 tablespoon licorice root pieces, mulathi, in 1 cup milk with 1/4 teaspoon saffron, kesar. Apply this paste on bald patches at bedtime continuously. Grind fenugreek seeds, methadona, with water and apply on the head. Leave for at least 10 minutes before washing. Do it every morning for a month. Boil 1 cup mustard oil, sarson cocktail, with 4 tablespoons henna leaves, mehendi. Filter and bottle. Massage on the bald patches regularly. Grind the remains of tobacco smoked in a hookah, and add to boiling mustard oil. Cool and store. Massage on the bald patches regularly. 18. Panchakarma therapies. In severe cases of thinning, Ayurveda Panchakarma therapies are useful, especially diet treatment is beneficial. In this therapeutic procedure, medicated oil is made to fall on the forehead for prescribed period. This oil stimulates the hair follicles. 19. Hair transplants in women. This procedure involves moving hair to thinning scalp areas from donor sites. The trouble is, female pattern baldness causes thin hair all over, so good donor sites may be limited. So, it is best to rely on Ayurvedic treatment for hair loss. 20. Hair loss products and devices. A quick internet search will turn up dozens of products intended to stop hair loss or regrow hair. Unfortunately, there's no way to know whether before and after pictures have been doctored. To evaluate a hair loss treatment, you need to check with your qualified Ayurvedic physician who can guide you in a proper way. 21. Coping with thinning hair. A shortcut, a gentle wave, a styling product, a medicated hair oil for thin hair may help hide hair loss. You apply it to the root area and gently sun dry to build volume. 22. Coping with significant hair loss. Adjusting to permanent hair loss is challenging for most women. If thin areas are very obvious, consider a weave, a hairpiece, a scarf, or a hat to cover bald spots. Good quality wigs are more comfortable than ever and they rarely have bad hair days. If hair loss interferes with your job or social life or makes you reluctant to leave the house, seek the medical advice. 23. Ayurvedic treatment plan. Please keep in mind that these are all common home remedies and first aid measures. If the problem continues, even after using these remedies, then you need to come for personal examination and Ayurvedic body type evaluation. In Ayurveda, there are excellent and powerful medicines for this condition. The best suitable drugs are selected basing on your individual body type, and prescribed along with personalized diet and lifestyle modifications.
So, hope you have enjoyed this topic and enlightened. In the next program, we will be meeting with another interesting and important topic. Shatam Jiva, Sarado Vardhamanaha. Shatam Hemantan, Shatam Vasantan. Live your entire life with excellent health and total happiness. Take care of yourself. శుభం.
Dr. Chirumamilla Murali Manohar, MD, Ayurvedam, Raksha Ayurvedic Center, Sardi Studios Road, opposite State Home, Amirpet, Hyderabad 73. Phone 9177445454.